for your health. It is Ovarian Cancer Awareness Month. September is a time to shine a light on what's sometimes called a silent killer. It's the second most common gynecologic cancer in the U.S., according to the CDC, and causes more deaths than any other cancer of the female reproductive system. So here to talk about what you need to know and what you can look out for, along with the future of fighting this disease, we have Dr. Weah Weisham, gynecologic oncologist at Compass Oncology, and Anna Demir with the Ovarian Cancer Alliance of Oregon and Southwest Washington, and an ovarian cancer survivor herself. Good morning.
Good morning.
Thank you both for being here.
Thank you.
Dr. Weisham, I want to start with you. Why is ovarian cancer sometimes called a silent killer? Why is this such a deadly disease?
You know, I think that in the very early stages of development, there may not be very many obvious symptoms, and then as the disease progresses, a lot of the symptoms of ovarian cancer overlap with symptoms that are seen in more common conditions, and so it can be hard sometimes to pinpoint exactly what's going on.
Yeah.
But there are symptoms of ovarian cancer, and they include things like abdominal bloating and pain, a sensation of feeling full early when you're eating, and so these are things that we ask women to kind of be aware of.
Yeah, but they are symptoms that can so often be dismissed. Women, we're busy, we got a bunch of things going on. I tell my friends all the time, I'm like, oh, time to play this game of like, is it my hormones? Did I sleep wrong? Is it this? Is it that? Anna, what would you say to women? What for you was really important in taking charge of your health?
Trusting my own body and knowing that my only symptom was a pain, a horrible pain that was, took me to the ground literally. Oh. But that was the only symptom I had, and I was postmenopausal, and I thought, oh, this is just my postmenopausal body. And then after a day or two, I thought, no, I need to trust my gut and get myself to the doctor. So, it is bloating, it is pain, it is early satiety, it's frequent urination, and those things, all of us, we will dismiss, and unfortunately sometimes our providers dismiss too. So we need to know that our bodies talk to us and that we have to listen and then voice our concerns to our providers.
Yeah, you really do have to kind of be your own advocate.
You do.
In so much of this, what did you find in going through this journey that made you want to become part of the Ovarian Cancer Alliance and try to create more of a community here? This can be a really isolating disease.
It is a very isolating disease. It's you have a 1 in 78 chance of getting ovarian cancer, either because of genetics or just pure not great luck, and so it's very isolating. You don't think that there's anybody else going through it. So after treatment, I wanted to give back to our community, give back to my ovarian cancer community, and so that's what we do at the Alliance. Is we put our arms around our community. We offer some really wonderful services like a support group, chemo care kits that you get at your first chemo session. We have financial grants, events, and things, because we are kind of a small community, but the Alliance does want to put its arms around all of our community, including, we include our providers as well.
Absolutely, and having these conversations, having conversations with providers can be so important. Dr. Weisham, what should patients do if they're worried that their concerns, could be brushed off, if they're not getting answers?
Yeah, I think I counsel patients that, because these symptoms can sometimes be a little vague, to keep track, to listen to your body, maybe write things down as they're happening. I think symptoms that are the most concerning are ones that are new to you as a person, symptoms that persist over several weeks or that become progressively worsened, and to bring those up to their providers specifically. Trust yourself, trust your gut, advocate for yourself, and if you feel like you may not be heard, it's okay sometimes to find another person to chat with that might be willing to hear what you're going through.
As we look at what's on the horizon, the future for this disease, are there improvements in the pipeline in testing and treatment? What do you want people to know?
Yeah, we've made a lot of progress in how we treat patients with ovarian cancer over the years. Unfortunately, we don't have great screening right now for this disease, and so we rely on developments in treatment. And the thing that I'm most excited for is that we've been able to take a group of tumors and kind of identify specific molecular findings that we can use that we can have targeted treatments for. And I think that's something that's really interesting that's coming down the pipe.
Yeah, it is getting better. The picture is improving, and of course, having that conversation can be so important. So thank you both for being here to do that today.
Thank you so much.
Of course, if you want to learn more about the work that the Ovarian Cancer Alliance of Oregon and Southwest Washington is doing, and what you can, the conversations you can be having this Ovarian Cancer Awareness Month, how to take action against this disease, check out this story on KOIN.